Zero.
Hi, we are sitting here with Sherry and David. And David, we did the human cellular tissue program on his left knee. Guys, what I wanted to ask first off is, when we were sitting and we were talking about doing this procedure, what were some of the doubts or concerns that you had before you said yes?
Is this going to work?
Yeah, that's a good one, right?
You know, and the fact that insurance companies don't cover this, which I don't understand as well. But the fact that we had to come out of our pocket to pay for this, which we felt that it was more than that it should be done. It had to be done, and so it was well worth the money to put up front to do it.
Because you had your right knee surgically replaced.
I did.
And didn't want to do the.
I didn't want to do the invasive surgery.
Didn't want to have to go through that again.
Right.
Sherry, if you wouldn't mind talking about some of the things that you saw with David, some of the things that you noticed him having trouble doing before having the first procedure.
Well, I guess it was a real eye-opener when our grandson said, "Grandpa, look, I walk like you." I thought he was going to die. He said, "Well, I don't walk like that." And then his son said, "Dad, you do walk like that."
It was so...
It was sad because he's an active person. He has projects he loves to do. He's a go-getter. And he hasn't been able to be the go-getter that I used to know.
So, David, before you had your first procedure, what were some of the things you talked about? Stairs.
Right.
How would you do stairs?
One step at a time. I could go up them okay if I had the handrail, okay? But going down was another story. It was one step at a time. Foot down, foot up. Foot down, foot down, foot down. Now I can go down them normally, and sometimes even without the handrail.
Really? No big deal. Just after the PRP.
Yeah, it took about a week, okay? With the brace on that I have that came with the procedure, it's been very, very helpful in strengthening my leg, and I haven't even had the stem cell put in yet, so.
Isn't that awesome?
Yeah,
right?
so, yeah.
And one of the projects you just said that you did...
I just got done laying bricks.
You just got done laying bricks.
For a landscape project that we've been doing. And I had to put off on it for a while because my legs were just hurting, my knees every day. I woke up with pain, went to bed with pain. And the only thing that would solve that pain was naproxen. Who wants to live on pain pills your whole life, okay?
Yeah.
So this, has been a blessing so far. Yeah,
so if somebody was thinking about doing this, David, what would you say?
I would say to go for it. Yeah, at this point, and do what you're supposed to do, okay? Wear your brace the 6 hours a day that you're supposed to do. Put the weight on your ankle that you're supposed to do. Try, to follow the diet. That's the worst part for me, and I snitch all the time, okay? I mean, I had a pork sandwich, okay? I had pork the other night. Well, I like my cow, and I like my beef, and I like my pig, and
So hopefully...
we're trying to stick with the fish.
Yeah, hopefully not overdoing it, right?
Not overdoing it, no, not at all.
If you have any questions with the procedure that we're doing with David's knee, you can call the office at 636-239-5252. Thank you.
Well, there's